Hi, this is Thomas Saz from Gateway Clinical, and I'm here to talk about the autonomic nervous system. Today's topic is, what is the autonomic nervous system, or ANS? The autonomic nervous system is the system that controls the majority of involuntary or automatic functions of the body. So think of autonomic as automatic. The autonomic nervous system regulates the body's responses without consciously thinking, such as breathing, heart rate, blood pressure, digestion, sexual arousal, and many other biochemical processes. The autonomic nervous system sends signals through nerves pathways to control and regulate most organ functions such as the heart, lungs, kidney, etc. The autonomic nervous system is a very complex system of nerves starting in the brain and sent via the spinal cord through peripheral nerves that extend to all parts of the body. Now, there are two distinct divisions of the autonomic nervous system. They are the parasympathetic system and the sympathetic system. The parasympathetic system is commonly associated with the rest and digest responses. These bodily actions needed to restore energy and rest the body. For example, chewing food triggers the parasympathetic system to increase production of saliva and to increase digestion in the gut. The parasympathetic system also increases gallbladder function, which assists in the digestive process. Now, conversely, the sympathetic system is commonly associated with fight or flight responses. These bodily reactions that you need to respond quickly in an emergency. When faced with a life-threatening situation, your human instinct takes over and you either fight the danger you are facing or you take flight and run away from the danger. Your sympathetic system allows your body to do this rapidly. For example, in the face of danger, your sympathetic system will cause bronchial dilation. This allows you to breathe better while you are fighting or running away from the dangerous situation. Likewise, your heartbeat will be stronger and faster, also prepping the body to fight or take flight. Disorders of the ANS can affect any system of the body. They can originate in the peripheral or central nervous system and may be primarily or secondary to other disorders. Symptoms suggesting autonomic dysfunction include orthostatic hypotension, heat intolerance, nausea, constipation, urinary retention or incontinence, nocturia, impotence, and dry mucous membranes. If a patient has symptoms suggesting autonomic dysfunction, cardiovaginal adrenergic and sudomotor tests are usually done to help determine severity and distribution of the dysfunction. One fun fact about the autonomic system is under the topic of sexual arousal. The sympathetic system, the fight or flight mode, regulates the male sexual hormones and the male sexual organs. The parasympathetic system regulates the female sexual organs. Now, if you think about this in terms of normal life, when a man gets ready for sex, he gets excited. When a woman gets ready for sex, she gets relaxed. So take that with you. That's Thomas with Gateway Clinical, and we just discussed the autonomic system. Thank you.